Welcome to this course on clinical antibiotic stewardship for South Africa. We'd first like to acknowledge people who've contributed to this course. The course is based on the SASP app, which you can see at the bottom of the screen. This is available in the Google Play Store and in Apple Store, and is an accompaniment to this course. The people acknowledged have contributed to the app as well as to specific lectures in this course. There's also a disclaimer which comes with this course. The course attempts to summarize relevant information for clinicians from South African and international guidelines, as well as with reference to textbooks and key publications, as well as expert opinion. It's important to remember that recommendations change rapidly and opinion can be controversial. The authors do not warrant that the information contained in this course is complete and shall not be liable for any damages incurred as a result of its use. The course focuses on principles rather than on specifics of antibiotic prescribing, and prescribers should always consult local guidelines to confirm that their choice of antibiotic is appropriate to the local epidemiology. The aims of this course are to introduce you, the healthcare practitioner, to the concepts of antibiotic stewardship, and to provide you with some practical guidance on antibiotic prescribing and infection control. The course is a series of lectures which are split into two sections. Section 1 looks at the principles of antibiotic prescribing, the use of certain tests, interpretation of results, and a guide to setting up an antibiotic stewardship program. In Section 2, we look at specific clinical scenarios in turn and give some guidance on the specific ways of approaching such problems. So why do we need antibiotic stewardship? Well, the simple answer is because the world's running out of antibiotics. The misuse and overuse of antibiotics has driven the selection of resistant bacteria, and this has got to the point where we're approaching the post-antibiotic era because we have nothing left to treat infection with. In the last 28 years, there have been no new classes of antibiotics brought to the market. That means the pipeline is essentially shut down. And looking forward in the next 10 to 15 years, we're unlikely to see any new classes of antibiotic. So as well as resistance rising, then drugs used to treat resistant bacteria are not appearing on the market. So what we need to do is revitalize the antibiotic pipeline. That means we need to look and see if any old antibiotics can work and find new ways of procuring new antibiotics. And we also need to conserve what antibiotics we have so that we reduce the increase in resistance. Antibiotic stewardship is one tool to help us achieve the latter goal. Antibiotic resistance is not a modern phenomenon. In fact, some bacteria have naturally occurring mutations in their genes which make them resistant to antibiotics. We call this intrinsic resistance. And if you look back to ice samples found in Canada from 30,000 years ago, you can find resistant genes that would lead these microbes to be resistant to modern antibiotics. It's also important to realize that resistant mutations can be transferred between bacteria, particularly by horizontal gene transfer on circular pieces of DNA called plasmids. Antibiotic-resistant bacteria are produced according to the rules of survival of the fittest, when resistant bacteria survive when the sensitive bacteria are killed by an antibiotic. If you look at this population of bacteria, most are sensitive to the antibiotic and a few are resistant. If you add an antibiotic, you'll kill the sensitive bacteria, leaving the resistant ones behind, and when these replicate, you'll be left with a population of fully resistant organisms. The more antibiotics we use, the more antibiotic-resistant bacteria are going to be selected out. If you look at this graph, it shows consumption of imipenem and resistance to imipenem in a hospital in the United States. You can see in the first arrow, consumption of imipenem started to rise, and it was quickly followed by an increase in resistance, seen in the solid line. Only once consumption decreased, as the dotted line goes down, was there a decrease in resistance. So antibiotic resistance is increasing worldwide. This graph is just an example. It's taken from America, which has long-term data. And you can see that from 1999 to 2012, there's been a steady increase in the resistance rates of E. coli to 3 major classes of antibiotics. We can see trends like this all throughout the world, including South Africa. This map shows the increase in antibiotic consumption per capita from 2000 to 2010 by country, and you can see that South Africa there in the dark red is one of the few countries to have greater than 80% increase in antibiotic use over that period. This slide is a projection of what we're likely to see by 2050 if nothing is done to address the problem of antibiotic resistance. You can see that at this time point there would be 10 million deaths from antimicrobial resistance per year, which would be greater than the number of deaths from cancer worldwide. If we lose the antibiotics that we have now, we'll lose modern medicine as we know it. It won't simply be that we can't treat urinary tract infection and pneumonia, but when it comes to surgery, we'll be able to perform less surgery because we won't be able to give surgical site infection prophylaxis. We'll be able to give less chemotherapy because we'll have no antibiotics to treat patients when they develop a neutropenic fever. And we'll be able to do less transplantation because we'll have no treatment for the infections that occur because of the immunosuppression that we need to give. Resistance in the community is largely driven by overprescription of antibiotics for respiratory tract infections. These are typically caused by viruses and don't require antibiotics. We often see antibiotics given for the common cold, for influenza-like illness, and for viral bronchitis, and this is one of the major drivers of resistance. Things are no better in the hospital setting. If you look at this graph, it shows the number of antibiotics individual patients are on at any given time in both the public and private sector. It's taken from the PISA study in South African intensive care units, and you can see if you look at the red arrow that there are patients that are on up to 10 antibiotics at the same time. Antibiotic stewardship makes up one of the three key pillars of the response to rising antibiotic resistance. It can be defined as a multidisciplinary systematic approach to optimizing the appropriate use of an antibiotic to improve patient outcome and limit the emergence of resistant bacteria whilst ensuring the safety of the patient. Put more simply, it means optimizing the prescription of antibiotics, making sure that we give the correct drug at the correct dose and dosing interval for the correct duration by the right route, and we de-escalate to the narrowest possible antibiotic whenever we can. The two other pillars start with enhanced surveillance, which means knowing the resistance profile of the bacteria that you're dealing with, which enables you to make appropriate empiric antibiotic choices, and infection prevention. That means preventing infections occurring in the first place so that we don't need to use so many antibiotics. This includes improving social determinants of health and improving water and sanitation. It means improving vaccination coverage so that we prevent vaccine-preventable diseases. And it means the reduction of transmission in the healthcare setting through active case finding, appropriate precautions, and most importantly, good hand hygiene. So in summary, antibiotic resistance is a naturally occurring phenomenon, which also can be acquired through horizontal gene transfer. It's antibiotic use that selects out the resistance of bacteria, and the misuse and overuse in the community and the hospital settings across the public and the private healthcare systems are the main driver of resistance. Antibiotic stewardship aims to optimize the appropriate use of antibiotics so that we can decrease the rise in antibiotic resistance.